Dr. Stanford Owen here, and welcome back to Phase 4 of the PrescriptFit Medical Nutrition Therapy Program. Now, if you're sitting there with your counselor at your doctor's office, or if you're at home, fill out our medical nutrition therapy follow-up sheet. Your provider will send us a copy of this so we can calculate the data for the clinic and see how well they're doing. Number one, fill out your basic information at the top, including your weight and your waist size, the diet strategy that you're using, PrescriptFit, Phase 4, any medication that you're taking. If there's been any deletions, just leave them off, don't add them in. The exercise that you're planning for the week. Have you discussed the program with your family, or are you struggling? Is the family struggling with you? Have you all discussed it? Is it on the table for discussion? Environmental cleanup. Again, getting sugary drinks out of the house, and pork, beef, dairy, and starches, wheat, corn, rice, potatoes, as much as possible out of the house. If it's not there, you can't eat it. Fill out your symptom sheet. Now, in week 4, you should clearly be having improvement in your symptoms. On a 0 to 10 scale, just record where you are this week. Oftentimes by week 1, Phase 2, Phase 3, Phase 4, your symptoms will really be starting to plateau at low levels. And if they're not, it could be an issue, could be a problem. You can email me directly if you've signed up to our support program, and certainly ask your medical provider. Your clinical measures, have your counselor fill out any new changes in your sugar or your cholesterol, and your plan of action for the coming week. Your diet strategy, you're going to be in Phase 4. Environmental cleanup, do you have any more work to do in that regard? Exercise, what is exactly your plan this week? How many minutes are you going to do per day, and what type? And have you discussed it with your family for the coming week? Any new changes in medications, including appetite or metabolism medications, added or deleted at the bottom. Hand this to your provider, and then start into Phase 4. Now, Phase 4 is non-starchy vegetables. Starchy vegetables are potatoes and corn, basically, and to a lesser extent, legumes. So those come into Phase 13. But all other vegetables, from your greens and your yellows and your tubers, those are all on the table. It's as much as you care to eat, in addition to Phase 3, which is poultry, Phase 2, which is seafood, in addition to the 8 doses of PrescriptFit that you'll be taking every single day. Vegetables are fun. Get as many colors as you can, as many varieties as you can. Maybe even have them for breakfast, some for lunch, some for supper. You can snack on them. So lots of vegetables. Vegetables are filling, they're full of vitamins, they're good for you. From our perspective, PrescriptFit is perfect nutrition. Everything else is entertainment. So vegetables really fill the bill in that regard. Remember, you're going to be in Phase 4 for 3, 7, or 14 days. Remember, if you're doing a very aggressive program and you're into this for 7, 8, or 9 days and you can't take it anymore and you're feeling cravings, jump to the next phase. Trick your brain into compliance by not feeling deprived. Deprivation should never be an issue, and hunger should never be an issue. If you're hungry, take more PrescriptFit. So, welcome to Phase 4, and we'll see you next week, Phase 5, which will be eggs.